Hey community, this is 𝗙𝗀𝗟 coming at you again, and today I got another webinar on healthy heart, keeping our heart healthy and not dying from a heart attack, or at least trying to prevent dying from a heart attack and putting all the information in your corner so you can avoid a heart attack as much as possible. So what I'm going to be covering in this webinar is the 5 must-know labs that you need to know to see how healthy your heart is and how healthy your cardiovascular system is. And this is the cutting-edge labs. Your conventional system medical doctor is not going to do these, and you can get them through me. So if you're watching this video, give me a thumbs up. Give me a comment below. Have you ever had these labs done? What's going on with you? So the first thing I want to go over is just some general stats. This comes from the CDC on heart disease. And basically what the stats show is basically every 34 seconds, someone is dying in this country from a heart attack or heart disease. 34 seconds. So this is astronomical when we talk about, how many people are dying. So there's a lot of things that you can do that you can put in your corner so you can prevent and stop any of these, cardiovascular events from occurring. Now, this is a very interesting study right here. This comes from the UCLA Health Department. And right here, I'm going to blow this up right here so you can see that. So what I'm going to go over, read this. This is a quote right from the UCLA is, new national study shows that 75% of all patients hospitalized for heart attacks had cholesterol levels that would indicate they were not high risk for cardiovascular events based on current national cholesterol guidelines. So 75% of people that ended up in the hospital when they did their blood panel would indicate that they were not at high risk for a heart attack, but yet there they are in the hospital with a heart attack. So what the heck's going on? It's not a lack of statin medications. They're not actually looking at the root cause of the problem. They're not looking at the new markers, the brand new markers that have come out in the last 10 years. Medicine, you go to your conventional provider and they are 20, 30 years behind the curve. Anything that's current, it takes 30 years before the conventional system, because it's so big and large, before they'll start to do it on a regular basis. Okay, so here we are, is the 5 must-know lab markers to save your heart. And we're going to go over 5. Now, the first 2, I'm not going to spend as much time on, but number 3, 4, and 5 are very, very critical. So if you're watching this video, you're going to want to watch the whole entire video so you get all this content. So the first thing is a fasting insulin level. So the first thing is a fasting insulin level, really, really simple to get. You can see here, this fasting insulin is 41. And you can see the lab range right here is basically 2.6 to 24.9. Now, here's the thing, the sweet spot, you can see here, the sweet spot should be around 5 to 6. So when I do labs, I like to see fasting insulin around 5 to 6. Now, if you know anyone that's a diabetic or pre-diabetic, what are these people really dying of? They're dying of cardiovascular disease. Why? Because they have too much sugar in their body. They're chronically inflamed. So fasting insulin is a really critical hormone. It's a hormone actually that will tell you if you're inflamed. Just give you a visual, is this will actually, it's actually like glass shards of glass floating around your bloodstream, carving and nicking all your whole entire endothelial system, causing inflammation, causing you to be prone for more heart attacks. The second marker I want to cover is homocysteine. Now, homocysteine is another cardiovascular event. People that have Alzheimer's disease, have Parkinson's disease, have cardiovascular events, have a high homocysteine level. Now, you can see this is one of my clients here. Their homocysteine is 44.6. Now, you can see the range is 0 to 14.5. Now, the sweet spot right here is around 5 to 6. So that's what I like to see is the sweet spot. So, these are indicators to see how much inflammation is in your body, because all disease, including cardiovascular disease, grows in a body, manifests in a body that is chronically inflamed. So these are 2 really, really important markers that will increase your body's inflammation and put you more at risk for a cardiovascular event. So really, if you have these tools, if you have these tests done, then you can gauge, and you have like a gauge of where am I at for the spectrum of cardiovascular disease. Do I have very minimal, or do I have a high spectrum of a possibility of a future cardiovascular event? Now, this is where I'm going to start to get into some really cutting edge specialized testing that really you can get anywhere in the United States. You just have to have a provider, a doctor, a functional medicine doctor that actually wants to take the time and actually dive into this to actually see what's happening and what's your true risk of cardiovascular events. So if you go to the conventional system and let's say your cholesterol is 200 and the cutoff is 200 and they automatically say, oh, you need a statin medication, they haven't cracked a book. They haven't cracked a book in like 20 years. Statin medication does not work. The benefits of statin medications are so minimal. But the thing is, they're in this conventional system. It's cookie cutter medicine. What functional medicine, what I do, and which is what we call functional medicine, is an individualized, tailored, custom plan for your needs, not on cookie cutter, not what your insurance company thinks that you should need. It's an actual independent thinking on what's actually going on with your body. Okay, so what I want you to bring your attention to is this panel, and we're going to spend a lot of time right in here, which is what we call the LDL, right? The LDL, quote, the bad guy. So this really isn't the bad guy. It can be the bad guy if you have these lab markers I'm going to go over. It can be the bad guy, but it's not necessarily always the bad guy. So you can see right here, this one here, she has, let me just kind of blow this up so you can see this really easy. She has an LDL cholesterol of 152. Now you can see the range here. You can see the range here is less than 100. So this is ideal. Now, what we're going to be talking about is the particle number. So how these lipids, like all these are different lipids, like cholesterol's a lipid, HDL, the good guy's a lipid. So they're just like little particles, right? They're little particles that are in your bloodstream. So when we talk about particle number, what we can actually do, we can take a sample of your blood and we can look at it and we can see how many particles of, quote, the bad, the LDL, do you have running around in your bloodstream. So this is a really advanced test right here. So you can see right here, this is the particle number, right? This is very critical. So this is advanced testing. This is called the NMR Lipo profile testing. Now, what you want to see here is this person has 1,600 particles. Now, really what we want to see this is less than 1,000. So she would be considered to be at the high level. And research has shown is if you have increased particle number, you are going to be more prone to cardiovascular events. Now, all the way at the bottom of this, if you see the PDF here, you'll be able to get the PDF somewhere. If you click this reference right here, this is where all the references are at, where I'm talking about and all the data on this. All right, so this is at 1,600, and remember, we want this to be less than 1,000. So what they're doing is they're measuring, let's say this is your blood. What they're doing is they're measuring how many of these little particles are in this little space. So the least, the better. You want less is better. Less is less likely for you to have a cardiovascular event. All right, so I like pictures. Pictures are worth 1,000 words. So I'm going to try and describe this so you understand what's happening. So you can see right here, this would be the LDL. So you see this right here, this is 100. So if you go up and you look at your panel right here, we're talking the LDL right here would be 100. All right, so this right here, the LDL is 100 on this one, this example right here. So if we moved on here, you can see this is 100 right here, and you can see that this is 100 too as well. Now here, they are counting this in particles. You see that right there? Let me just kind of blow this up a little bit. You can see that this is in the particle size. Okay, so this is in the particle size. So you have the level here is 100 and the level here is 100. And you can see here, this is the cholesterol balance. So it's just telling you that it's all level. So you have 100 on one side and 100 on the other side. Now, what do you see? What's the difference? Now here, you can see this is a large particle versus a small particle, but they're still 100, right? They're still 100 and 100, but yet this has less particles, this has more particles, and in fact, this has up to 70% more particles when we actually check your LDL levels here. See, this is where the finite tuning comes from, is the more particles you have, that's the increased risk for cardiovascular events. So here's another great visual. So you can see here, this would be the particle number. You see here, so this is LDL of 125, 125, 125, 125. So they're all 125. So if you get your labs bag and it says LDL, so I just want to make sure we're all on the same page. Now, this person has 125 LDL, but they have large LDL particles. And this one down here has a level of 125, but they have many small, dense LDL particles. So you can see in here when it comes to cardiovascular risk, this person right here is at a higher risk versus, so Jerry's at a lesser risk and Maria here is at a higher risk. Now, why the heck is that? So I'm going to be going over why this is, why you have an increased risk when you have more particle number. So the third test here is measuring the particle number. Okay, that was number 3. Then number 4 is measuring the size of these particle numbers. So once I go over what the particle number, then the size, then I'll show you how this all correlates. So yes, ladies and gentlemen, what they say is what? Size matters. Yes, indeed, size matters, and your LDL particle size matters too, and I'll explain that in a little bit. So this is advanced testing, so this is 2 different tests. So this would be one client, and this would be a second client. Now, how they really describe this in here is you have a pattern A. You can see the pattern A. This is a large pattern. So you have pattern A, which is large. Then you have pattern B, which is a small pattern. Now, let's kind of roll up here. So again, down here, you can see this right here. So the large pattern right here, which would be pattern A, and then this is a small pattern. The small pattern would be pattern B. So in this person here, you have these large LDL particles, and you have less of them. So a couple things happen. So 1, you have less particle numbers, and 2, you also have the size of these particles are nice and big and fluffy, versus right here, who has more of a dangerous particle, is they have more particles and the particle size is very, very small. That's the difference. That's where the power of this test comes in. You can actually measure the size of the LD particle. So you can measure how many you have, and then you can measure how small they are. Now you want these small, big, fluffy LDL particles because they don't damage your arteries as much as the small ones. All right, so I want to show you this here just to give you more visuals. So this is the lab I just showed you. So this person has a small LDL particle size. So you can see this pattern right in here, and this would be the large. So they are in the smaller size. So their measurement right here is 20. Now what happens here is this would be the large, fluffy type. So this is a large, fluffy type LDL, and this would be the small, dense, high-risk LDL particles. These would be like the bad guys. Now my analogy is going to be this. When it comes to your arteries, imagine this. These large, fluffy ones are like cotton balls. So when it's in your artery, these big ones kind of bounce off the artery and they don't get stuck in there. Where if you have this small BB shot, these really small BB shots can get stuck in the arteries and cause inflammation. So it would just be like this. It would be like, this would be an analogy. Is if we're going to go on the highway, we can have 100, let's say we have 100 people and we have 10 buses. So we have 10 buses and each bus has 10 people in it. So we have 10 buses and each bus has 10 people in it. So we have 10 buses going down the highway. Or we could have 100 people in 100 individual cars. So when you talk about 100 individual cars or 10 buses, where's the likelihood that there's going to be more of a car accident? Obviously with the 100 cars. So this is what happens when you have more of these particles floating around in your arteries. There's more probability for those that cause damage, those that irritate the endothelial lining and cause inflammation. So we want these fluffy, healthy ones. So if you know this, you measure this, you can actually change the outcome. So you can go from small to large here. So this is a really another good picture. You can see right here, these are the LDLs. These are the small ones. And this right here, right here, this would be your endothelial lining. Like it's one cell thick. So when you talk about your arteries, it's one cell thick from the blood to the inside. Now, when these are really small, they can break through these linings right here, and then they cause this thing right here, which is called a fatty streak, which is basically the plaque that slowly starts to develop in your body. Now, if you have big, fluffy LDLs here, they can't get in. They hit that endothelial lining and they bounce off, and then they don't develop this plaque. This is the critical part when it comes to large, fluffy ones and not having as many LDL particle number. This is another really great picture I like. So here we have the large LDL. So this would be the large LDL, large, and this is the small one. So this would be the endothelial lining. So I kind of, I put this in here. Now what we're talking about, there's this one cell thick right here. This one cell right here. This is what we're talking about here that gets damaged and where the plaque starts to develop. Now what happens is on these big ones here, they just bounce off, right? They bounce off and they don't actually cause irritation. Now these small ones right here, they can get in on these little lines right here. You see these little cross lines right here? That's where these cells line up like this. And this is where these small LDL particles can get inside of here and start causing inflammation. Inflammation starts to happen, and then you start to develop a plaque in your arteries. So the real culprit of the whole thing is these small little ones get in the endothelial lining, and then they cause chronic inflammation, and that's where the plaque actually starts. So just going to your conventional system and saying, hey, my bad cholesterol is low, that doesn't indicate anything, because you can have a low LDL, like on the labs, but all yours could be really small BB shots, right? So you can have a low LDL, but still have small little BB shots, just like in here, right? This is really the distinction. Now, the lab number 5 that you can do, and I do on my clients, is what we call oxidized LDL. Now, this would be my analogy, like a banana. When a banana rottens, you would not eat that banana. Why? Because it would taste nasty. It causes inflammation. Just like if you have an apple, you take a bite out of an apple, if you come back an hour later, it's brown. That is oxidized. That is rotting the apple. It's rotting the banana. Just like your LDL particles, they can rot and they can get oxidized as well. So this is a lab that I run. It's oxidized LDL. So what we're really looking for here, we are looking to see if these little BB shot, if your LDL particles are rotten, if they're oxidized, if they're rotting like a banana, right? And you can actually measure that. So this is one of my clients here. Check this out. 554, that's his lab. Now the range here, you want this to be less than 170. Now I like to see this 70 or less. So if you come in and you have a high oxidized LDL and you have small LDL particles and you have a high number, you are a heart attack waiting to happen, right? So this is where all the specialized testing comes in. Now here's another picture. You see a picture. You see this LDL right here, and then this would be the endothelial cells right here. They break in. Right? This is damage. They're small, and then they start to oxidize, and then they start to rot, and this is when they cause the global inflammation in your body. Okay, this is where I want to take you to here. As you can see here at the beginning, I went over this stat. This is why 75% of the people that had heart attacks had normal cholesterol level, because they're not diving in and looking at these other different markers. Now, there's a bunch of other markers that should be looked at too that your conventional medical doctor doesn't run because insurance doesn't want to pay for it or whatever. So you can actually get a more accurate measurement of what's happening with your body internally. These are what we call biomarkers. So a couple key takeaways here. High insulin, high homocysteine, and high inflammatory markers make all these worse. They make your LDL particle number worse. They make the LDL particle size worse. And they make the oxidized LDL particle worse as well. That's why you deserve a workup, right? Every 30 seconds, like someone dies of a heart attack in this country. I've been speaking here for about 20 minutes. So that's roughly 10 people have died right now from cardiovascular disease. You deserve a workup. If you like this video, give me a thumbs up, subscribe, share it. We need to get this content out because at the end of the day, there's way too many people suffering needlessly. They just need to be told where to go. They just need a guided path to get better. So with that, remember, is where there's help, there's hope. Take care. Bye-bye.